Okay.
Mr. Walsh, next question.
Yes, this is for Congressman Hurt. The Republican Party in general has been talking for quite some time about repealing Obamacare. As some of these tenets of the bill start to kick in, they turn out to be quite popular with the American people. Can you outline for us what aspects of that bill you would seriously support or think about retaining, which aspects of it you might be inclined to get rid of, and what I have a feeling one you would try to get rid of is an individual mandate, and how in that absence this whole thing might be paid for.
Well, and I thank you for the question. I would say that, while there may be some things that as the bill is unveiled that the people like, but I would say that in my experience, and maybe yours is different, but in my experience, as I travel across the 5th District and I talk to individuals who are terrified about the status of their health care, what's going to happen to it under this law, when I talk to businesses whose premiums have just gone up when what they're trying to do is the right thing, and that is provide health insurance for the employees. When I talk to those folks, when I talk to doctors who say, listen, I mean, not only is this going to kill me, but I'm just thinking about just totally getting out. And you hear stories of doctors who are getting out. There was an article in the Wall Street Journal, about a month ago that talked about the real crisis we're going to be facing when doctors finally decide that they don't want to be working for the government as in practicing, what they were put on this earth to do. What I would say is I would give the president credit for recognizing that there that we've got to improve. There are ways to improve access, and I would suggest that there are ways that we need to lower health care costs. I just disagree with the way he has done it. I think that you are right. I think it is incumbent upon the Republicans, if we want to repeal the bill, to replace it. We need to replace it with something that works, that lowers costs without jeopardizing the quality of care in this country, and we have done that. If you look at the Energy and Commerce Committee, we have offered our solutions. With respect to things that I would keep, I don't know that I can say that I would keep anything in particular. But I would say this: I agree with the principle that we need lower costs healthcare in this country. I just don't believe forcing people to buy insurance is the way to do it, and I don't believe that capping people's care by using this independent physicians advisory board, this board of unelected bureaucrats to make decisions about our health care is the way to go.
How is it going to be paid for? Whatever system comes in, is it just going to be? Part of President Obama's plan is you have to have everybody in order to keep the costs down. But if you don't require everyone to be in, how do you pay for it?
Well, I think from my standpoint, the reason that I believe that healthcare costs go up, the reason that I believe that they will go up, and the reason that we're seeing it now, is because of a couple of things. But I think that not having a robust competition in the insurance market is the reason for that. And if we end up finding ourselves in a place where we have a single payer system, which I think is where we're headed. When you see the number of small businesses that tell me, they're like, there's no way that I'm going to participate in this. I'll just pay the fine. When you look at where we're headed with this, I foresee, and we're already seeing evidence of it, that the costs are going to go up. What we have offered on the House side have been bills like tort reform. Listen, billions of dollars are spent every year in malpractice premiums. Billions of dollars are spent in defensive medicine, doing tests just so you can say to a lawyer that you did the test in the deposition, even though it does nothing for the patient. That's wasted money. When you look at allowing insurance companies to sell policies across state lines, so we have a robust insurance market like we do in the car insurance. I mean, good gracious, look at the car insurance commercials. You might see those as much as you see our commercials on TV. If that's the kind of thing I think that will ultimately drive costs down and only improve healthcare without putting a sledgehammer on the system, like I would submit, with all due respect, that the President's healthcare law does.
Yeah, it's my turn. Well, to start right out by answering your question, I certainly wouldn't cancel the President's affordable health care program. I think we need to keep it. We've come a long way in developing a national health care program. I served in Europe and Asia. I saw other nations' health care programs. Our system before this program was pretty dysfunctional. And I'll tell you something, folks. I wonder if my opponent ever spent a day of his life with no health care. I know what it's like to be a homeless kid in your car with strep throat and not know what to do about it. When I went to the University of Florida and worked my way through, it was mandatory. If you were a student in that school, you had to pay for a student insurance policy or you couldn't enroll in that school. You know, I don't see the difference between that and what we're trying to do here on the federal scale. Meanwhile, not only is the other side of the aisle, trying to, how many times they voted in the House to repeal Obamacare? 33 times. They didn't have time to pass a farm bill, but they voted 33 times and lost 33 times. The Supreme Court said the bill works within our Constitution. So, instead of trying to take health care away from our people, I think we ought to look to how can we take care of the people in this country. They're trying to turn Medicare into a voucher program so that you got to have one of those flim-flam vouchers like we're handing out tonight plus $6,400 or go to the ER. I think that's wrong for our people.
Thank you, General Douglass.